All right. Hello, everyone. We are the CYC Crickets, and for Journal Club this week, our article is called "Non-Suicidal Self-Injury in Adolescence." Um, and I'm going to pass this off to Abby, who's going to go over the bio of the authors of this article.
The article that we chose is peer-reviewed and a case study. The authors that wrote this article are John Peterson, who was a director and an associate professor at Denver Health Medical Center. He works in the Department of Psychiatry, and he attended medical school in California in 1983. He did his residency and fellowship through the University of Colorado. Stacy Friedenthal holds a PhD as an assistant professor, Graduate School of Social Work, and attended University of Denver. She specializes in clinical social work, mental behavioral health, social justice, and suicide and prevention. She has written over 70 articles on her website and published a book called Helping the Suicidal Person that contains tips and techniques for professionals with evidence-based instructions and guidance on assessing risks and building coping skills. She holds a PhD in social work, Master of Social Work, and Bachelor of Journalism. Christopher Sheldon holds a PhD. He's an assistant professor in cognitive and behavioral psychologist in the Department of Behavioral Health at Denver Medical Center. Randy Anderson works in Department of Behavioral Health in the Medical Center in Denver, Colorado. I will pass it off to Soli.
Hello again. Now, the purpose of this article was to understand why adolescents engage in non-suicidal self-injury and to figure out how to support individuals who do. It makes connections to how adverse childhood experiences are an important factor to this behavior in young people. And the researchers approached this article through the use of a case study on a 15-year-old girl who uses non-suicidal self-injury as a coping strategy for her more negative emotions. And they used the case study in conjunction with other available research at the time of them writing this article to identify the characteristics, functions, and treatment strategies for adolescents who engage in this behavior. Now, I'm going to be passing this off to Jasmine, who is going to talk about their findings of this article.
Hello. So, although we didn't identify any specific research questions, in this article, we believe the article was done for folks to gain more knowledge and understanding of non-suicidal self-idolation, or non-suicidal self-injury in adolescents. Next, I'm going to talk about some of the conclusions and findings that we found in this article. So in conclusion, after reading this article, we learned that self-harm among adolescents is common and that the rate may be increasing. Teenagers presenting with self-harming behaviors should have a thorough psychiatric assessment that includes screening for suicidal ideation and risk factors. We also learned that family and other interpersonal supports are important in formulating and implementing treatment recommendations, as we know as CYCs. Pharmaceutical treatments should focus on treating underlying psychiatric disorders, and psychotherapy treatment should be recommended to assist the adolescent in understanding NSSI. A finding that was mentioned in this article was that adolescents with NSSI demonstrate higher levels of psychological arousal during a stressful task compared to adolescents without NSSI. Next, I'm going to pass it on to my teammate Sheridan, who has more to discuss relating to our article.
Thank you, Jasmine. Next, I'm going to discuss if there was anything we disagreed with in the article, and if so, why. There is nothing that we disagree with in the article as a group. As a team, we thought they gave a good overview of non-suicidal self-injury and how it relates or differs from attempted suicide. They also provided us with a case study about a young person with non-suicidal self-injury, which gave us insight on what non-suicidal self-injury looks like. Next, I'm going to discuss what more do you think should be done to explore the topic. A lot of treatment for non-suicidal self-injury involves DBT, which stands for dialectical behavior therapy. My team was wondering if this was the only treatment option and if there's more research to different treatment options. We feel there should be more research into different treatment options for non-suicidal self-injury. Next, I'm going to hand it off to Jeshin to discuss ideas they found useful or relevant for future practice.
The ideas that my team found useful and relevant for our future practice, there were a few of them. So the very first one would be the fact mentioned that 15% of youth with developmental disabilities engage in NSSI. And then they talked about the reasons why these youth engage in non-suicidal self-injury. And some of the main ones that were mentioned was, one, to feel in control. Some youth said they wanted to, quote unquote, feel alive. Some said it calms their mind. Some said that it actually helps them prevent suicide itself, which was very interesting to me. And yes, if I didn't mention, it was also to feel in control. And this then links back to the case study linking NSSI and adverse childhood experiences, especially child abuse. So this connects very well with what we learn in class about the youth who have been through trauma, who have been neglected in their earlier life, how they seek control and they seek belonging, which is what youth try to gain when they self-harm. So that was an extremely useful information. Also, there's always been this stigma around self-harm about how it's attention seeking and how they're trying to manipulate their adults or their peers. But this article mentions how the youth who do engage in NSSI do so in private, and they will rarely, if ever, come up to you and tell you that this is something they're doing. So I think it's a not nice, but a way to refute that particular argument, which stigmatizes self-harm and the youth who might try to seek help, who have engaged in self-harm. And then it also talks about the importance of including family and how it increases proper communication between the family members, them understanding why the child self-harms, and then you can include the family in helping building some coping strategies and even practicing problem-solving skills. And as CYCs, understanding what need the child or the youth is trying to meet with these certain self-harm strategies, so we can replace them with healthier options, so they don't have to always fall back to these negative coping mechanisms. So that was extremely useful. And even understanding the why, so you can empathize with them better. If you're in the field and you know why somebody self-harms, or you have an idea of why somebody does that, we found that to be extremely useful. Next, I'll pass it on to Vicky to conclude our discussion.
Thank you very much, Jeshin. That is a great outline there. I will now jump in to discuss the relevance of this article to child and youth care practice. First, as most of us might have read, a lot of research and studies indicate that non-suicidal self-injury is relatively common among adolescents and young people. In fact, this article particularly identifies lifetime rates in these populations to be about 13 to 23%, with onset typically occurring around the age of 13 or 14, which of course is our domain of practice. Secondly, as child and youth care practitioners, we have an obligation to be well versed in current research and theories in human development, which includes understanding history of some of the behaviors that present in young people. And honestly, this article had several aha moments that largely highlighted our understanding of the what of non-suicidal self-injuries as well as the whys. I know some of us have worked with or had or known a young person who self-harms. So I just want you to think back to what your first thought was about the young person and their reason for doing it. Or if you have self-harmed, think about what people around you said or how they handled the situation, and then relate this to your understanding right now after reading this article. What I'm saying is that I feel that this well-outlined analysis is an eye-opener and gives us a therapeutic perspective of non-suicidal self-injury that can guide our practice as child and youth care practitioners. The authors also mention that effective treatment is grounded in collaborative understanding of the function of non-suicidal self-injury for the adolescent, which is true. If we are to effectively support young people who self-harm, we need to be able to answer several questions like, what is non-suicidal self-injury? Who does it affect? Why is a youth or a young person self-harming? What can we do about it? How do we know if a young person in our care is self-harming? What can we do if a young person in our care self-harms? And luckily, this article answers most of these questions for us. And Gaffert, while defining relational child and youth care approach, mentioned that child and youth care practitioners are situated to be among the most influential of healers and helpers in a young person or family's life. But how can we help or even influence this healing when we have no idea what the problem is, and when our understanding is based on mythologies or a different perspective? So redirecting our understanding of non-suicidal self-injury and why a young person might be inclined to self-harm not only makes it easier to talk about it when it happens, but also gives us the ability to be more empathetic. So that is what we had for our discussion. I'll invite my team back and then we'll leave you with our critical thinking question. Right. I think we have everyone back. Thank you, my team. Our critical thinking question is, the article highlights that one of the reasons young people engage in non-suicidal self-injury is interpersonal other-focused. That is to say, the need to influence others. So in relation to the developmental stages, do you think this has something to do with Erikson's identity versus role confusion, or is it anything to do with brain development? So thank you so much for taking the time to read and watch our video, and we cannot wait to hear your thoughts in the journal club. Thank you.